Well, thank you all for joining us today for this webinar. Before we get started, I just wanted to make a few logistical notes. This meeting is being recorded, and we will share this recording at a later date once we have it captioned. So you can keep an eye out in the coming weeks for this recording if you'd like to share with your friends or your networks, or just rewatch it for yourself. We have disabled the chat function for this webinar. This will allow everyone to sort of pay attention to the incredible content that's being shared. So if you do have questions, please use the Q&A function that is at the bottom of your screen. It says Q&A. And there you can put in your questions. I will be looking at these as well. The panelists will be looking at these throughout the presentation. We will try to get to the questions if possible. If we do not get to your question, I will be sharing an email address at the end of the event if you'd like to have further conversation with us or have further questions. Finally, we do have closed captioning available for this webinar. If you'd like to activate that, at the bottom of your screen, there should be 3 dots that say More. If you press that, there should be an option to start captions. If you have any questions about that, please use the Q&A function and I will quickly troubleshoot that with you. Now I will pass things off to Dr. Aaron Baggish, who works with me at the Football Players Health Study, to kick off this webinar.
Thanks, Paula, and greetings, everyone. Thank you so much for taking the time to share what I think is going to be a fabulous webinar with our FPHS team and a group of amazing invited folks that will share the podium with me. I'm just going to offer some basic introductory remarks about what we at the FPHS do to set the stage for tonight's discussion. Next slide. So the Football Players Health Study at Harvard is now coming close to its 10-year anniversary. We started in 2014 as a group of scientists, really representing all of the health disciplines that are relevant to former professional football players, including heart health, brain health, musculoskeletal health, to really try to understand for the first time the impact, both positive and potentially negative, on life after the game. We are currently the largest study of living former players. We have more than 4,000 men who have completed baseline survey information with us, and a vast majority of those have followed up with repeated questionnaires. We also recently completed a very ambitious program in which we brought a number of men into the Boston area for a 3-day battery of head-to-toe testing to really understand from start to finish what the body inside and outside of a former football player looks like. One of our commitments is to make our cohort as diverse as possible and to capture the full spectrum of age, self-identified race, and player position that go into the game of football. And importantly, the work we do is much more than about the lifespan, which is the number of years that an individual lives. We're really about the health span. And that's the number of years that people live without chronic disease, without chronic pain, without chronic disability. An underpinning of all of the work we do is on the importance of health equity, race, and discrimination. And we're learning, as many of you would surmise, that this plays a big role in the health and wellness of the entire society we live in, but certainly former professional football players. The way we do our work is to focus on being player-driven. And what I mean by that is we engage members of the former player community to understand what exactly they're interested in learning about, what are the afflictions that they feel like they deal with on a daily basis, and how can we help them better understand what's subjective, meaning what they feel, and what's truly objective disease. And obviously, our goal is to help treat and ameliorate things that they may be dealing with. I would say our overall mission, if you will, is to explore, establish safe and effective ways to intervene. So to understand how we can make differences in some of the dysfunction, whether it be heart or metabolism or at the level of the muscles, that contribute to decline in mortality in former players. Next slide. So I'm going to ask my colleague and close friend, Dr. Rachel Grashow, to talk you through a little bit about the pathophysiologic, meaning the disease scheme work that we work on within the Football Players Health Study.
Thank you, Aaron. I'm really pleased to be here. So my name is Rachel Grashow, and I'm going to speak really briefly on both the way that player health is conceptualized now and the direction that we are trying to take it in. So generally speaking, players and the general public have a really preconceived notion about player health. And it looks something like this: that professional football and all that it comes with, like head injury, lead to changes in the brain and mental health. And this in the long term leads to cognitive dysfunction and decline. And by this, I mean issues with memory and thinking and processing speed. And what you'll see in here is really the conceptualization of, of CTE, which is absolutely real and is a part of what players think about in terms of their health. But at the moment, the narrative around this is that really that CTE is pervasive. Everyone has it. It's permanent. There's no treatment or cures. And that it's progressive and that it'll get worse. But in the Football Players' Health Study, we also want to remind everybody that it's not just cognitive dysfunction and brain health that's important. Actually, cardiovascular problems like heart attacks and other blood pressure and other long-term issues are just as much, if not more, of a challenge to player health. It just hasn't really been talked about yet, or as often as we think it should be. So in our study, what we're doing is asking, how does professional football affect the heart and vascular health? And in turn, how does that affect players' long-term cardiovascular health and dysfunction and decline over time? And we're excited about this particular avenue because there's actually something you can do. Unlike this upper pathway, there are medicines and lifestyle and dietary changes that players can do to protect their heart and their vascular health and to protect their cardiovascular health long-term. The piece that's often ignored in all this is that the heart and the brain are actually very intertwined. And taking care of the heart is not only taking care of the heart and vascular health does protect cardiovascular health long-term, but it also protects the brain. And when the heart and vascular health isn't doing well, that affects things like memory and cognition and processing speed. So the idea here behind what former players are thinking about in terms of their health and where we're trying to go is that we're really taking a broader look at player health. And I know this is a very busy slide, but what we're trying to look at for us is what are the ways that professional football doesn't just affect the brain and mental health? How does it affect hormones? How does it affect the heart and the vascular system? How does it affect sleep? And how does it affect musculoskeletal health? With the ideas, if we can look at all these pieces and how they play together, we can look at how that affects thinking and memory long-term, how that affects cardiovascular dysfunction and decline, and also how it affects chronic pain and disability. And along those lines, thinking about the whole player and the whole life, we want to think about these things called social determinants of health, like income, experiences with racism and discrimination, diet and exercise. All of these components playing together to kind of fill in or create what player health is. And so we want to go after all those pieces. And I'm not going to ask you to look at all the different arrows on this, but it's just to say that player health is very interconnected. And our hope is that by intervening on the heart, on sleep, on the brain, and on things like hormones, we can actually improve cognitive dysfunction, we can prevent against cardiovascular dysfunction, and we can prevent against chronic pain and disability. So this is the overall picture that we're working with. So now I'm going to turn it back to Aaron.
So in our work, both work done, work ongoing, and work that we plan for the future, we are really focusing on the importance of blood pressure control. And the reason for that, as Rachel just walked you through quite elegantly, is that we have now a clear picture into the importance of blood pressure management for the prevention of diseases in many different organ systems, including but not limited to the brain. And so one of the campaigns, if you will, that we've come up with is termed the Over-Under campaign. This is not a reference to gambling, but a reference to the fact that blood pressure is defined by an upper number and a lower number, and that understanding this interplay between blood pressure and total body health provides a real opportunity for individuals that are either at risk for high blood pressure or who have it and don't know it to be proactive, to do things to improve their blood pressure and ultimately to improve their long-term health and wellness. Next slide. We're going to have a lot of opportunity to talk about blood pressure tonight, but just to start from some basics. Again, blood pressure is defined by two numbers, an upper number, which doctors call the systolic blood pressure, and a lower number, which is called the diastolic blood pressure. These refer to the pressure that the blood places on the vessels when the heart is pumping, that's systolic, and when the heart is relaxing, that's diastolic, and both are independently important. And what we know is that a normal blood pressure is less than an upper number of 120 and a lower number of 80. And as the blood pressure increases above these in a stepwise fashion, high blood pressure becomes more severe, and the risk of developing complications of blood pressure problems also becomes more severe. Now, blood pressure is not the only issue, and we'll be talking tonight about all of the other things that factor into brain health, heart health, musculoskeletal health, chronic pain. But these include things like tobacco use, weight gain, sugar metabolism problems, simply the fact that we're all aging with time. And one of the things we want to impress upon you is that we're working hard to untangle this complicated mesh and provide you with some salient solutions moving forward. Next slide. So I'm going to show this now, and we'll have an opportunity to return to this later in the presentation. But one of the resources we've created is a checklist, if you will, that you can bring with you to your physicians. It's basically a checklist to health. And what this allows you to do is go into your doctor's office with a list of things that are on your mind, not necessarily to tell the doctor what to do, but at least to start discussions. And this may prompt, in some cases, blood tests. It may prompt careful checking of blood pressure, a discussion about sleep habits, pain, memory, thinking, concentration. But what we really want to do is raise the issues and then provide some options. And these options, importantly, are not just medications. These are easy things that can be done at home by yourself, changes in lifestyle habits like diet and exercise, improving your community outreach. So all tangible things that we can each do as individuals to improve our health. Next slide. So we have tonight a fabulous panel of people. I think they're all going to have an opportunity to introduce themselves. We do have disclosures of each individual shown here for full transparency. We're fortunate enough to have Dr. Amy Perlman, Desmond Howard, and Mark Asper as our moderators tonight. And with that, I will say no more and turn it over to the real stars.
Hey, party people, we are coming at you live from Coral Gables. They call it the City Beautiful, but I don't know. It looks pretty handsome today. I'll be here for the next 45 minutes or so. Mark, kick us off here, buddy.
Hey, hello, everybody. I'm Mark Asper. I went to the University of Oregon from 07 to 11, professional football, all over there. I'm a typical journeyman, offensive lineman, all over the East Coast from 2012 to 2017. I now have the privilege to work with Boston Scientific. It's a medical device company doing patient education. I've worked with their chronic pain division. And then close to home, my dad's a prostate cancer survivor. So I work with prostate cancer urology division now, helping educate men about the disease state and treatment options that are available to them.
And what is some of the concern that you have regarding men and men's health stigma? How does that play into your life?
So as a former player, I know a lot of you probably are in the same boat. We get a lot of information about CTE and a lot of information about our neurocognitive benefits and things like that. When I got done playing, I worried that everything was related to that. If it was, I wasn't sure if it was normal aging or if it was something, if something was wrong. And I was almost too afraid to find out because I was worried that finding out meant I was one of those guys that was going to have, like like Rachel talked about at the beginning, things that were untreatable and irreversible. So I'm reminded of a story my offensive line coach once told me. We were on the field. It was after practice. We were watching tape, and the guy next to me, I was playing right tackle. The right guard didn't do his job. I did my job. I was expecting an attaboy, and my coach turned to me and he's like, "You don't like your buddy next to you? You don't like?" I was like, "What are you talking about? I did my job." And he's like, "Yeah, but he didn't. Did you know what was going on? Did you know what the play was? Did you know what to do?" And I said, "Yeah." He said, "Why didn't you tell your buddy? You're on the same team. You're on the same line. We have to function and cooperate and work together. If he doesn't know, doesn't matter what you know." So a lot of the information that we're going to get here in the next little while, right, that information is only as good as our ability to use it and to communicate it to each other and to our other fellow players. You know, we got Des here to help out with that as another former player. I'm excited to be part of this, but the biggest thing is not knowing is worse than, or not knowing is the worst case scenario, basically, right? Find out so you can learn about the options and the things that are out there that are available to move forward. Don't be afraid to find out. It's an easy process. Des and I were talking about that just a second ago. He was asking, you're getting those emails? Yeah, I'm getting those emails too. That's, initially that's kind of all it is. There's a baseline assessment, and then there's just follow-up emails of getting information that about how you're doing and what health challenges you're facing at this stage of your life post-career, and how those, that collective research is all stuff that's going to help out other former athletes. And as the time continues to roll forward, as more athletes get into that former player pool, it's just more information available to them.
Thank you so much, Mark, for sharing. So my name is Amy Perlman. I am a board-certified urologist with expertise in men's health. Thank you all so much for joining us today. And we have a lot to cover, so we're going to get started. You already met Mark Asper. I'm going to introduce you here to Desmond Howard. Des, you're normally on college game day football, and you're talking football. Today, we're talking about men's health.
Exactly.
So analyze this. What do you think is going to play out here?
Well, like Dr. Perlman said, my name is Desmond Howard. I play 11 years in the NFL. Now I do college game day, but as a former NFL player, I understand how important our health decisions are. And as you get older, whether you're a football player or not, whether you're male or female, you're going to come across some health issues. And I once saw a doctor who said that, genetics can load the gun, but your decisions and your practices will pull the trigger. So the decisions that you make, the micro practices that you engage in, that's what's going to trigger whatever genetics you have in your body. So I think this is a very important topic. I take my health extremely seriously. I have a lot of challenges because I travel a lot. And when you travel, you may not come across the best cuisine, and you have to manage what you eat and how you eat and portion control. So there's a whole lot that falls under this umbrella. I'm just honored to be here, to be able to share some of my experiences with you guys, and also to hear from the panel and learn too.
So let's get a little bit more granular here, Des. When you get to a new location and you're getting ready to get on screen, you show up to the hotel. Right. What are you doing? So
my routine is I show up to the hotel, I put my stuff in the room, and I immediately go find a fitness center. I want to see what type of equipment I have access to. So then in my mind, I can put together some type of workout regimen. And then also try to find restaurants that will serve food that I would like to eat, And so those are the two most important things I can do: figure out where I'm going to work out and then what I'm going to eat. Yeah, those are my two biggest things. And I travel a lot, so it becomes challenging because all fitness centers aren't built the same. So sometimes you got to improvise, but you do what you do while you're on the road. So it's a challenge, but it's a challenge that's worth it, because at the end of the day, it's all about my health.
Yeah. And so much of what you're saying here is it's really these micro decisions that all of us make on a day-to-day basis.
Absolutely.
That make major changes.
100%.
Hinges move big doors. That's what we're talking about today. Things that we can do immediately as soon as this session is over that will change our health.
That's right.
He actually has to hop off in about 10 minutes because he's doing a live event. So make sure to stay tuned for his live event for College Game Day Football at 2 p.m. So let's introduce our panelists here. Bucky, kick us off.
My name is Bucky Dilts, went to the University of Georgia, played in the NFL 3 years. I was a punter. In relation to what we're doing today, I'm a prostate cancer survivor, have survived 14 years. And it was all my detection of prostate cancer was due to my father and my uncle both getting with me and telling me we had family history with prostate cancer, and for me to monitor and check my PSA, which I did. As soon as I got a jump in the PSA, I was really proactive. I didn't want to wait around and see what it was. I went ahead and got a biopsy, and it was there. So I then had to decide on the type of surgery I wanted to do, and did that. And my PSA has been almost at zero for the last 14 years. So I'm quite happy about that. I've changed my eating habits. I changed my exercise habits. And I'm a promoter of prostate cancer awareness. Do it here in the local University of Colorado Health Sciences Center, and want to be a part of getting the word out to the NFL in particular and colleges. So I'm working on that right now with the Pro Football Retired Players Association to get the word out about prostate cancer in the coming year.
And what do you want people to know? Why does it matter so much to you to get this word out?
Well, I guess the biggest thing is a lot of guys don't want to talk about it. And I don't care. I can look at people. I used to go to Bronco alumni meetings, and they brought up that I was a survivor, and then everybody corners you in the room afterwards, kind of secretly, to talk to you about it. So it's not, guys aren't good about taking care of their health. So whether I get to the guys in particular or I get to their spouses, I have to get to somebody who can get them to establish a relationship with a primary care physician who can aid them in a lot of the decisions, not only in prostate cancer, but for the rest of they can do.
Yeah, absolutely. And we thank you for all the work that you're doing. Now, Mark, you also have a family history of prostate cancer. And so we want to emphasize that one of the big risk factors for prostate cancer development is knowing your family history. So what did those conversations look like for you and your dad?
Sounds similar to Bucky's conversation, where it was just, and as I've been in this job field and learning what the contributing factors are and the higher probabilities of that, it was like Bucky said, it's not an easy conversation. We don't talk about our health enough as men. So hopefully through the course of this, what's presented today, you guys will feel comfortable to have those conversations with your brothers, your teammates, your family members, and be proactive about it.
Yeah. Hey, Bucky, can you provide some advice for people tuning in? How might one open up that conversation with a family member to understand family risk?
Well, it's kind of difficult because even in some cases, even the family member want to talk about it, because back when it happened before, it was even almost even more taboo to talk about those kind of things. So you probably have to, in my case, it was easy for me to talk with my mom, who could then get to my dad, and then the discussion ensued from there. So however the best way it is you can navigate with your family to do that's important. And the other thing, Amy, that I want to stress here today is that prostate cancer doesn't have any overt symptoms. In other words, you could sit there, I could have never and still have prostate cancer, and I would have been dead 5 years ago, because then it would have spread, it metastasized, and then there's nothing to do to control it. So it's important for people to be aware of their family history, get a hold of a physician, have the discussion with them. There's a lot of options and a lot of new treatments as well.
Mm-hmm.
So, Bucky, we've talked about having a discussion, but could you give us an example of how to open up the discussion for family or for friends? Because we're all concerned with former teammates, family members, and other people who we love. So how do you open up that conversation about that with anyone, whether it's a family member or just a friend?
Well, what I usually do is I go ahead and lay out that I have prostate cancer and that I've survived it. So I can level the playing field or ease people's tensions by saying, look, I had it, I went through this. And then that's either going to prompt them to want to ask me. I'll also bring up the thought that my family history had a lot to do with it. So if I can just tell them up front what occurred with me, and then begin to ask them if they've been checked or something, it's a little bit easier to get the conversation going. And in most cases, it's pretty successful. In a lot of cases, I get guys to go out and get screened.
Bucky, I love that point that you just made. So it's starting with us and then opening up that conversation rather than right off the bat asking about someone else's health.
You need to almost kind of make a quick personal investment in that person. And then when they begin to trust you, it's a lot easier to have that conversation.
Absolutely. Hey, Rodney.
Hey.
You're up next, buddy. I want you to introduce yourself. And then what is your message for the group? Why is men's health interesting and important to you?
Oh, do we have an hour and a half? Oh my God. My name is Rodney Peete. I went to USC, played in the NFL for 16 years for 6 different teams. And currently now I host a radio show in Los Angeles, Monday through Friday. I also, along with my wife, we host a dating show on Peacock, believe it or not. Which is going to start its 2nd season here pretty soon. So that's a good one.
I don't have people.
It's called Queen's Court.
Now I have to go. Now I have to get Peacock.
Yes, you do. Yes,
because of you and the Big Ten, I got to get Peacock.
Yes, you do. As you get older, I think when we're talking about health, and Bucky said it right, we as athletes are so conditioned to ignore the pain, to ignore symptoms, to ignore everything. You got to get back on the field. You got to play at all costs. That can mean your job. That can mean not being in the league anymore. So you ignore it. And as much as you think that won't translate or carry on after you're done playing, it does. And that mentality does carry on after you retire. And you start thinking, hey, I don't need to worry about that. I don't need to go to the doctor. I can handle it and deal with it on my own. And usually the way you deal with it on your own is to try to cover it up or mask what's going on by either, taking pills or doing something else that will temporarily take away the pain or the symptoms that you may be having. But I think the best thing that Bucky said is if you can relate something personal to whoever you're talking to. Like 5 years ago, I had my knee replaced. So whenever I see someone that is a former player that is limping or is struggling to walk or whatever, I always bring it up. Hey, I had my knee replaced 5 years ago. It's the best thing I ever did. And you should think about doing it if you got any kind of knee problem. And that opens the door, as Bucky mentions, opens the door for them to talk about their issues. And that can lead to maybe I'm having, issues with high blood pressure, or there's a history of diabetes in my family. Those type of things will open the conversation. But the most important thing, I think, and the reason why I'm excited to be a part of this study and part of this panel is you have to have a strong community. And that community is either your family or close friends that are not going to be yes people, that are going to tell you the real and give you the truth and tell you, hey, man, hey, you got to go to the doctor. You got to get yourself checked out. Are you doing all the things? And really not take no for an answer. Had it not been for my wife watching me walk like a cowboy bow-legged for 5 years after I retired and telling me you better go get that thing fixed and get a knee replacement, I probably still would have been walking around with a bad knee. So you have to have those people in your life that give you that tough love. And that is the community that in which we're talking right now, and then extending that community to others that may not know about this or want to somehow get engaged. That's our job, is really to help our fellow members, and whether that's men, women, family, friends, whomever, to understand that your health is nothing to play around with, but it's also something if you are ahead of it, and early prevention, early detection is so key in so many areas that it could prevent a lot of troubles later in life.
Awesome. Rodney, thank you so much for sharing. And we'll definitely tune into your show on Peacock. And last but not least, we have Dr. Lawrence Jenkins, a fellow urology colleague of mine, and he's over at Tulane. Dr. Jenkins, want to introduce yourself here?
Sure. I'm a board certified urologist. I'm based at Tulane University in New Orleans, Louisiana. I am fellowship trained in male sexual and reproductive medicine and surgery. And so my main mission is working with guys, whether it's after prostate cancer survival, to treat any symptoms that they may have with sexual function or urinary function, but also work with guys on their testosterone and hormones and other things that go towards men's health.
Wow. So you just gave us a lot of loaded information there: men's sexual health and male hormonal health and reproductive health. So can you make that a little bit more granular? What are we talking about when we talk about erectile dysfunction, hormone issues, and how common are those conditions, particularly in the former athlete population?
Well, I mean, so let's start with sexual dysfunction. Let's start with erectile dysfunction because it's a very common disease amongst the entire population. So they say that 50% of men in their 50s are going to have erectile dysfunction, 60% of men in their 60s, 70% of the men in their 70s. So it's something that guys don't talk about, but it's actually very prevalent. So that's the most important thing, is guys talking to their doctors, to their providers, to get that information so that they can be treated as needed.
Awesome. Thank you so much. So we are going to keep an eye on the Q&A here. You know, the focus of today's session is to really focus on heart, hormones, and prostate cancer. Actually, September is Prostate Cancer Awareness Month, so that's why the prostate found its way into this session. And there are a lot of questions that people asked about CTE and brain health, and we're really going to focus on what you can start doing today to optimize heart and hormones to improve brain health. So Dr. Baggish, from your point of view as a cardiologist who, focuses on former athletes and current athletes, like, what do guys need to know? What are decisions they can start making today, whether it's their sodium intake, their exercise, nutrition? Are there like 5 key items that are really good for people to start eating or moving their bodies?
Yeah, Amy. So let me start with the easiest one. I mean, if we had to choose one thing that we could all do on a daily basis to improve literally every organ system in our body, including heart, including brain, including liver, including kidneys, it's routine physical activity. And it doesn't need to be running a marathon. It needs to be simply getting up and going for a brisk walk, or if you choose to do something more intense, riding a bike, going for a jog. This is literally medicine. And it is something that, regardless of whether you live with pain, whether you live with brain dysfunction, there's always a way to find an opportunity to move. So that's number one. Number two on my list would indeed be the single most important next thing would be avoiding cigarette smoking. For those in the audience that smoke cigarettes, please stop. I know it can be difficult, but it is without question one of the easiest modifiable things we can do to live long and live well. Next on the list would be diet. And although we don't know a whole lot actually about diet, even though it's been well studied, some simple basic things become very important. One is avoidance of saturated fats. So those are fats that are solid at room temperature. So butters, dense cheeses, meat products, which have visible fat. Those, they may taste good, but they just simply aren't good for you. And along with that comes salt reduction. And I think the final thing, and we'll maybe get back to this at the end when we look at our checklist for health, would be reducing stress. Stress is a big player, and stress is a big player with respect to brain health, but also with respect to cardiovascular health. And there's lots of different stresses that we all feel. Some of them come from work, some of them come from family, some of them come from simply picking up the newspaper and reading about what a troubled world we live in from day to day. But anything that can be done to reduce stress goes a long way to keeping us strong and healthy over the years.
So I want to go back to that first comment that you made about exercise. And I think a lot of former athletes are thinking they need to go to the gym and lift really heavy weight, but you're telling us that simply a brisk walk can be really beneficial for our health.
I'm telling you that as little as 10 minutes of brisk walking on a daily basis, and of course more is probably better, but as little as 10 minutes, that's simply walking from the end of the shopping mall parking lot to where you buy your groceries, has a marked impact on health. In fact, just as little as 10 minutes a day reduces your all-cause risk of dying by 20%. There's no medication in the world that does that. So this is incredibly powerful and something we can all, even those that live with disability, find a way to do.
Wow. So truly food and exercise as medicine and really as first line therapy. And I think a really big challenge for us as healthcare providers is making lifestyle modification really sexy. We're so focused on all this high level technology and surgery, but at the very foundation, it's what do we do when we wake up in the morning and how are we moving our bodies, which is awesome because that doesn't cost a lot of money. I love that message.
Yeah, and we have an opportunity to allow technology to help us with this, right? Every single person has some form of wearable device in the form of a smartphone now, whether they realize it or not. And for those that are incentivized by seeing numbers, take a look at your daily step count. Take a look at your daily minutes of vigorous physical activity. These tell a story. And if they're sufficient, pat yourself on the back. If they're not, think about what the obstacles were and make changes.
We talked a lot about preventative, early onset, start. How do you, what's the first thing? What's the check engine, before the check engine light comes on? What's like the regular first step? Look under the hood. What am I looking for? If I'm first time I'm going in and asking a doctor about my heart health, what do I want to find out first?
Well, we've already heard about the importance of family history. And indeed, this is something we can all do. And that is sit down with our loved ones and talk a little bit about their journey and what they've dealt with. And if there's a family history of heart disease, specifically coronary artery disease, that's a wake-up call that, again, there's at least a genetic predisposition. And that arms the doctor with some tools that helps the doctor put you into a higher versus a lower risk category. And then the checklist, again, as we'll look at on the document that we put together at the end of the call, is not that difficult. It's talking about blood pressure. It's talking about cholesterol. It's talking about the presence or absence of diabetes. And then it's the lifestyle factors we just talked about: exercise, diet, stress, and tobacco consumption.
Awesome. Thank you. Bucky.
Yes, thank you. Just a little something about how a lot of the guys out there can begin to start this, because I know a lot of them I've talked to, they're a little down at the time when they're really overweight or they haven't done much physical activity. About a year and a half ago, I went through the NFL and got the brain body scan and all that, and I really saw how bad and out of shape I was. And I came back and I said, okay, I'm going to set a plan. So I went to my doctor. I got all my figures of my blood, everything else. And I said, I'll see you in a year. And I set up a plan to go out and begin walking because I really couldn't even run because I was a little hefty. And I started, and I get to where I walk 45 minutes to an hour, 3 to 4 times a week. I started to lift weights lightly, and my activity level was much higher. I went back to my doctor this year, and I also changed my eating habits and shrinking portions, eating the right kind of thing, better things, not necessarily the right kind of things. I still like my craft beer and stuff like anybody else, but in the year, I dropped 14 pounds. That's not huge, but that's a lot of weight if you try to carry around 14 pounds. And so on that process to do that, but you just have to you have to go get your baseline from a doctor, okay? Then you got to set goals and a plan, and then you got to go do it just like anything else. So I just wanted to drop that in there to kind of give people a way to maybe to start up.
Don't sell yourself short. That is huge. If we lost 10, that's 10% of, we lose 10% of her right here. It was 14 pounds. But I'm going to advocate too for the brain and body thing. Very similar. I kept putting mine off because I was afraid to find out. We've talked about this before. I was afraid to find out the results. Like, I have some knee pain, or I forget where the car is parked. Is like, am I just getting older? Am I just getting further removed from playing, or is there something really wrong? And I was kind of afraid to find out what was really going on because I didn't want them to tell me, yes, you have these problems, and yes, but that family history, finding out whether the news was good or bad. Fortunately for me, it was good news. Or they say, no, you're in good health. It gave me a lot of confidence to move forward with life. Like, okay, now I know where I'm at. I have a better plan in place to get through things, right? So any of you guys out there that are not, that are afraid to find out, just advocating again to you, go find out.
Yeah, it seems a lot of that was peace of mind, and peace of mind means a lot, especially Dr. Baggish, what you were saying for stress, right? Peace of mind can absolutely reduce stress. Hey, Roddy, when you were having issues with your knee, how did your exercise routine differ, let's say before, when you may have been impaired and not able to do a lot of exercise, to afterwards? And what does it look like today?
Well, it became null and void. I think as when you retire, you're like, okay, I'm gonna continue with a lot of the exercise that I did when I was playing, and that lasts for about a month, and then you're done. You're like, I'm putting that off. I'm not gonna do that anymore. Forget all that gym. But the weight became an issue, right? I became larger and larger and larger, and it wasn't coming off like it did when I was playing. And it's in general, when you get older, it doesn't come off. The weight doesn't come off like it used to. And certainly as an athlete, you just don't even think about it so much. You're like, okay, I got to get ready for training camp. I need, okay, all I need is a few weeks and I'm going to get right back into shape, and the weight's going to come off and I'll make my weight when I go and report. That doesn't happen when you retire. So, and then it affected everything. Not just my knee being sore and tough to get up in the morning, and taking 30 minutes to kind of get to a point where I could just even walk to the kitchen. It affected my mood, my brain health. Just I was short with family members, and just the overall attitude. I didn't want to get up and go places because I knew that was going to create pain in my knee. So once I did get that done, it just like a light bulb went off. It's like everything is related, which is why this is so great when we talk about, and initially a lot of people have questions about CTE and brain, and the beauty of the study is that it's studying the entire body and how the entire body affects everything, whether that be family history or your knee problems affecting your mood in the mornings or during the day. And so once that light bulb went on, I ended up changing my routine because it was about walking and moving. And Bucky's right, just doing something. And the doc said 10 minutes a day is great. If you do taking the stairs instead of the elevator. I mean, it's simple things that you can start a routine. For me, it was instead of going and heavy lifting or doing any kind of, I know a lot of quarterbacks don't heavy lift anyway. What are you talking about? We don't. But for me, it turned into doing yoga and Pilates and really doing a lot of stretching. Really, really helped me because after my surgery, it was about getting my range of motion back and breaking up all that scar tissue. And once I figured out how stretching really affected me, I really continued that. in terms of Pilates and in terms of yoga. And now I don't go to bed, and it's the first thing I do when I wake up is do some sort of stretching routine and at least move for 30 minutes.
Yeah, awesome. I don't want to throw DBs or RBs under the bus, but there's been more than one time where I've gone to an alumni event and I see a dude and I go over and I'm like, oh, hey man, did you play guard? Did you play center? And he's like, I played running back, y'all. My bad. You just look like you played guard or center. My bad, man.
Dr. Jenkins, I wanna move it over to you here for a moment, because you see a lot of guys coming in with hormone issues, and the conversation around testosterone is so taboo because it is considered, a performance enhancing drug when people are in, professional organizations, but it can be an incredible tool when people have legitimately low testosterone. So what do these guys look like when they come in to see someone like you? What are some of their presenting concerns? How do you check for low testosterone? And what are the implications when it comes to who can benefit?
Okay, great questions. So typically guys are coming in to me to see me. Either they're referred because they had their testosterone level checked as a blood test, but the symptoms are low energy, low libido, erectile dysfunction, increased fat deposition, decreased muscle mass, depression, possibly poor sleep, possibly some confusion, short-term memory loss, or some reduced endurance. So all of these are very non-specific, and they're not necessarily always tied to testosterone, which is why we need the blood test to go along with it. So we need 2 early morning blood tests showing that they are low, along with the symptoms to have a diagnosis. So, it's a simple blood test. It's not anything scary, unless you're afraid of needles. But it's a simple blood test. And then once we have all that, we can create this get an overview of what's going on with the guy's health, because testosterone's tied into various other medical problems or symptoms, and as guys get older, their testosterone is going to naturally decline. So that's one of the biggest things, is like, as guys start getting out of their 20s, their testosterone is starting to decline for the rest of their life. So some guys really associate it with just the natural aging process, but some of this can be a true low testosterone. They notice they're not keeping up with their friends on the golf course. So yeah, there's various things that can be done to treat it, and I'm sure we're going to go into that in a little bit.
Yeah. And what I find interesting when it comes to the low testosterone conversation is a lot of people think that the presenting symptoms are erectile dysfunction and low libido, but the ones that you listed off, actually, the minority of symptoms are related to sexual health. The majority are how our brain works, how our heart works. We know that low testosterone is a risk factor for heart disease. So there was, research put out over the last 10 years that there was a lot of concern about testosterone and the impact of a major cardiac event. Folks, we've debunked that. So we can safely put people on testosterone and improve their insulin sensitivity and blood pressure control and weight. So the symptoms are so varied. And as you mentioned, the blood tests are pretty simple to do, right?
So yeah. You mentioned blood tests. I know, Bucky, you mentioned earlier about with prostate cancer, a PSA. So similar question to you that I asked to Dr. Baggish. What's the under the hood check when I go to my urologist? What's the kind of the thing I should be asking to find out in my blood work? I have an over under for my blood pressure. What's kind of the area that I need to be asking my urologist about?
So how might someone, Dr. Jenkins, if they're worried about low testosterone, how might someone open up that conversation with either a primary care provider or someone like you?
I mean, that's just very easy. It's like, some guys, they're coming to see me because they're urinating frequently. And then they're like, at the end, hey, doc, how about testosterone? So it's just a simple blood test that I toss into the results. All you have to do is just simply ask, hey, doc, I'd like to get my testosterone checked. And they can just toss it into the regular blood work.
Absolutely. And oftentimes you know, we think about testosterone for muscle building and for bone health. And that's where when we think about, Rodney, you had mentioned like gaining weight and no longer being able to lose that weight that you used to be so easily, you know, have been lost. And that's a lot what I see in clinic is guys who come in, they're, let's say in their 30s or 40s, and they say, I used to be able to drop 10 pounds so easily. Doc, I'm struggling. They are going to the gym. And like Dr. Baggish mentioned, they are walking and they're moving their bodies and they're still struggling. And folks, that might be reason enough to ask for your testosterone level to be checked.
And throw in all, yeah. And like they said, that resource at the end with the checklist that has little, hopefully it outlines those numbers that you should be asking for.
Dr. Baggish, do people come in to see you talking about hormones or asking about hormones and the impact on cardiovascular health?
They do quite frequently, and it's something that you know, the short answer is yes, but I really want to use this incredible discussion about low testosterone as an example of something, and that is, if you think about the symptoms that Dr. Jenkins so nicely laid out for us, the obvious ones that most of us would be familiar with are sexual dysfunction, but low testosterone has a number of other effects on the body. Most importantly, it can affect thought processes and cognitive function. And if you go to your doctor and identify as having trouble with your memory or trouble with your thought process and tell your doctor you're a former football player, there's a very real chance they are just going to jump to the conclusion that this is CTE. Now, we can't exclude that that's not part of the equation, but what I want everyone on the webinar to realize is there is a long list of conditions that cause symptoms that are similar to those we believe are attributable to CTE that are not CTE. It could be as simple as getting a blood test and starting a medication and fixing that symptom you have. So it's just a great example of what we think we know about CTE and what we still have to learn, but also the treatable conditions that may mimic it.
Yeah, absolutely. Dr. Jenkins, going back to you, when you've had guys come in and you've started them on testosterone therapy, what are some of the things that they report in terms of cognitive function or memory or like pep in their step? Do you see that impact?
Well, I mean, it's just general comments on like they just feel younger, like they're moving better. I mean, the most common thing is on a golf course. They're feeling they're keeping up with their buddies. You know, they're able to think better, think clearly, rather than having just kind of like a fog or forgetting things as much. Just a little bit sharper.
Hey, Doc, can I ask something?
You sure can, Rodney.
So when someone finally gets the courage to ask the question, okay, I got low testosterone. What do I do, Doc? And then you see, you know, all of the commercials out there with the Big Hurt and Doug Flutie and all kinds of supplements. How do you navigate what is the best situation for you? Is it going directly to your primary care physician, or is it over the counter supplements and what's good, what's bad? Because we're bombarded by so many things as we see, and a lot of times we want that quick fix, and maybe that quick fix is not something that's doable for us.
Great question. So, you know, I would say going to your primary care provider is probably the best thing to do to get started out, because a lot of those vitamins and supplements, they're not regulated by any industry. So we don't know what's exactly in there. And also there's not good data to support that they're actually effective at improving testosterone levels anywhere near as comparison as actually replacing testosterone. So I would start with the primary care provider.
You know, it's interesting because when you walk down any of these convenience, you know, store aisles and you see all those supplements, wow, I want all of them too. And I'm a woman, right? It's billions of dollars that's spent on marketing for these products, and they promise a lot, you know. But at the end of the day, hormones are incredibly important. So I find that for a lot of guys who see me, they've asked their primary care provider, if they've asked an endocrinologist or a urologist to check their testosterone. So I think it's, and a lot of times people say, I'm not checking it. There are major barriers and challenges in our healthcare system. So I think from my point of view, it's just finding a person who's open to checking it and can have a really informed conversation about one's hormones. And sometimes it's a cardiologist, and sometimes it's an endocrinologist, and sometimes it's a urologist and a primary care provider and a functional medicine specialist. It's more so finding someone who can talk about hormones rather than their actual specialty. but I'm putting a huge plug in for people to advocate for themselves. There is no other condition that I see more than the low testosterone where men really have to advocate to get tested and treated. So it's just finding someone, who can really have those informed discussions. But the other point that I wanted to make is the advice for nutrition and exercise. It's all the same information, whether we want to optimize our brain health, our heart health, our bone health, our genital health, our gut health. The recommendations are anti-inflammatory nutrition. Fruits and vegetables, folks, it's the colors of the rainbow. It's lean protein. And really, when we focus on what fuel we're putting in our bodies, everything gets better. The recommendations are all the same.
Pivoting a little bit into something you said, talking about primary care doctors and going in, I'll admit, guys, I'm one of those, didn't have a primary care. When I got done playing, right, you had team doctors, you had all these guys looking after you forever and ever. I didn't have a primary care doctor forever. I recently tore my Achilles. Part of that, realizing I aged 20 years in one weekend, realizing I need to get out there and I need to talk to these guys. But don't assume, and I work in medical, I can't cover my mic, sorry. And I work in medical education for a medical device company, right? We do patient education events all over the country. Don't assume, I learned going through this as a patient with my Achilles. A lot of you guys will know this if you've gone through any kind of major injury when you were playing. Don't assume the physicians know everything in your best interest, or that they're going to automatically tell you everything in your best interest, right? Oh, you should be doing these tests. Oh, you should be getting this done. Oh, you should have this done. They may be doing tests and running your blood, and it's something as simple as, hey, I want to know what my testosterone level is. Hey, I'd like to know what my PSA is. Bucky, I'm going to bring you back into this. What did you was that your experience? Was that something when you wanted to find out? You said you had that family history. You started advocating for yourself. What was that conversation like with your physician?
Well, my primary care doctor really was kind of like, hey, you can go get checked if you want to. And even when I talked to somebody who was involved in prostate cancer and, hey, Bucky, you have cancer, but you have these options now that you have cancer. You can do watchful waiting and these other things where if it's a slower progressing cancer, there's different ways you can react to that. You can look at the cell type. You can look at Gleason scores. There's all these kind of things you can look at. But to me, I had to go find out. If there was a chance that cancer was in me, I was going to have a biopsy. And they've done a lot of things. I'm sure Dr. Perlman, you can talk to this too. There's probably lots of new ways that they can do things to detect cancer in people that you all could speak about outside of a biopsy, because I think some people can find that sometimes invasive, and there could be complications with that as well.
Yeah, technology in healthcare has changed so much. Even something like prostate cancer, which is a very common cancer that affects people, the technology, it's no longer like a finger in the bottom. And if that's abnormal, then we go to a biopsy. Now we have MRIs. And just to go back to the digital rectal exam, sometimes that's a big barrier to people even going in to see a urologist to get screened. So it's really understanding, okay, do I need this test? And is my test even being checked? A lot of guys, when I ask, has your PSA been checked? A lot of people say, oh yeah, it's done with my regular blood work. So it's asking your primary care provider, which lab results are part of my routine blood work, so you can get those numbers, and always ask for a copy of your results so you have them in hand. Because as some of you may or may not know, all the electronic health systems, they do not communicate with each other. So I love when my patients come in and they have a stack of their labs and some of their notes that can be incredibly helpful. So it's knowing what blood tests you're getting checked. So we're gonna wrap this up here. I'm gonna have Rachel and Paula wrap us up. We are gonna stick around for 30 more minutes because we had some more personalized questions that we'd like to address in the remaining 30 minutes, but we are gonna wrap up this initial session. So Paula, Rachel, take us home.
Awesome. Thank you, Amy. This conversation has been phenomenal. And yes, as Amy, Dr. Perlman mentioned, we will, some of our panelists will be sticking around. We can't answer clinical questions, but there are some questions that I've seen in the Q&A that we will be able to answer, and with other ones, let me just share my screen. So following this webinar, in the next week or so, you will be receiving an email from the Football Players Health Study with information about the study, information on some of the research and results that were discussed, like what Dr. Baggish was talking about earlier with our hypertension results. Resources from us. I've seen some questions about the Trust Brain and Body study, other things that the Trust may provide. We have contacts for people there if you need to be connected with them. So we'll have some resources from that, as well as resources and health tips from our panelists. So there's going to be a huge amount of information headed your way in the next week, as well as a survey about this event, which we ask you to do because it helps us figure out what webinars or in-person events to do in the future so that we can keep getting you this critical information. And then, as I mentioned earlier on in the event, this is being recorded, and this recording will be sent out via email and posted on our website at a later date within a month or so. So once we send that out, please share it with your friends, with your former players that you know, sort of former teammates, to continue to sort of share this information. And I just want to highlight one of the resources that Dr. Baggish and Dr. Grashow showed earlier on in this presentation. We have been working on this checklist for tackling personal health for a long time. We've heard from players that this is something that would be really helpful to walk into an appointment and say, these are the things that I need to know, as well as sort of some of the different prevention and treatment options. So we are finalizing this resource, and it will be on our website, as well as a downloadable PDF that is interactive, so you can check the boxes, which I find to be very satisfying. So that you can have it on your phone, take it to your appointments, email it to your friends. And while this is primarily developed for former players, it is a really useful resource for everyone. We all should be focusing on preventative care and taking care of our health. So you can share it with your family members or anyone else. So this will be coming your way within a week, but just wanted to highlight it. We're very excited about it. And yeah, we hope to see you at our future events and on our email list and everything else soon. So just wanted to share that logistical announcement. I know we do have to wrap up, but I will be staying on, and some of our panelists, if they're available, will be staying on to tackle some of the questions that we are able to answer in the Q&A. Some of them we are not able to answer, but the ones that we are, we can address, and we will make note of the other ones for future webinars.
Thanks, Paula. Dr. Baggish, I'm going to put you on the spot here. What's the role of some of these special cardiac testing, like the cardiac calcium score, or when does a stress test play a role, and nuclear imaging? When would someone need some of those tests done?
Yeah, so gosh, we could talk about this all night. I'll try to be very brief. So calcium scoring, which is looking for calcium deposits in the coronary arteries, has become an increasingly popular screening tool. I would say for those on the webinar that come from a long history of being highly athletic, that you should probably not go through a calcium score. And the reason for that is that we know that you can get calcium in your arteries two different ways. One is by having risk factors like high blood pressure and high cholesterol. The other is simply having exercised at a high level for many years. And when you get that score back, your doctor's not going to be able to tell you what to do with it. So the take home there is avoid the expensive fancy test and just simply address the things that we know matter, like cholesterol, blood pressure, diabetes, and smoking. Stress testing is a slightly more complicated thing. There's really no rationale for a young, healthy person who feels no symptoms to have a stress test. But as we start to get older, if we have any symptoms to suggest there might be underlying heart disease, so this might be pain, pressure, or tightness during exercise, breathing that you feel is just harder than it should be for your effort, then discussing a stress test with your doctor, either a regular stress test or in some cases using something like nuclear perfusion imaging, is quite reasonable.
Awesome. That was a very helpful response. Are there any blood tests that people should get checked, whether it's a fasting lipid panel or other things when it comes to understanding their cardiovascular health?
Yeah, so I advocate for a fasting lipid panel, which measures cholesterol. So total cholesterol, good cholesterol, which medically is called high density or HDL, and bad cholesterol, which is low density or LDL. That's the basic. In addition, everyone should have a fasting blood sugar level, a glucose level, and increasingly we're looking at markers of inflammation to round that out. So the most common of those would be something called C-reactive protein or CRP. So from a primary screening perspective, that would be the basic, and that's what I do with all of my patients that come in and ask about their risk level.
Okay, awesome. Let's see. I'm going to go through some other questions here. So let's see. Thyroid hormone. Is that part of routine screening? Are you checking thyroid levels?
I am checking thyroid levels, particularly in anyone that has any sensation of heart arrhythmias. So the feeling of skipping or jumping in the chest, that can often be a reflection of high thyroid levels or even low thyroid levels. So I do include that, not as a basic screening, but in anyone that's feeling symptoms that would suggest their heart is having any rhythm troubles.
Mm-hmm. And what might that feel like? How would that come about?
So in general, we don't feel our heart. We might feel it beating very forcefully when we're exercising, and that's normal. But the sensation of feeling your heart particularly do things that are abnormal or irregular. So the concept of a single forceful skip beat or a string of skip beats when you're just sitting at home watching a football game or relaxing with your family, that's not necessarily a bad thing, but it could be. So when people feel that, we definitely encourage a discussion with the doctor, and oftentimes checking a thyroid hormone level is part of that evaluation.
Gotcha. Dr. Jenkins, I'm putting you back on the spot here. So let's go back to the testosterone and hormone conversation. How can we hurt someone with testosterone? Because it's not for everyone. So what are the key things we need to keep in mind when it comes to risks of testosterone therapy?
Well, I mean, one, we don't want to put someone on testosterone who doesn't truly need it because there are risks. So one of the main risks, raising testosterone levels will increase the number of red blood cells in the body. So if that number gets too high, that can clog arteries and veins and put someone at a higher risk for heart attack or stroke. So we don't want that. So that's why you got to put the right person on it, and make sure that their levels don't get too high during treatment.
Mm-hmm. And then you had mentioned that you also specialize in reproductive health. So what do we need to keep in mind when it comes to testosterone and reproductive health and fertility?
Yeah, so by taking testosterone exogenously, so by artificially taking testosterone, your body's going to see that and it's going to be like, oh, we don't need to send any more signaling to the testicles to make our own testosterone. But what goes along with that, it's not going to send signaling to make its own sperm. So for someone who's still interested in fertility, they're not going to be on, they shouldn't be on a regular testosterone regimen because that will shut down their sperm production, and decrease their chances of fertility in the future and require a lot more work trying to get that kick started back up again.
Yeah, so a lot of people think that if someone has low testosterone, then taking testosterone will improve their ability to have a child, and it's actually the opposite. Bucky, back to you, my friend. So you diagnosed with prostate cancer, treated for prostate cancer. We know that a big barrier to people even getting treated is, what if I have it? What if I get treated and now have side effects like erectile dysfunction or urinary leakage? How did you deal and overcome some of those side effects related to treatment? What's your message for the group?
Well, first and foremost, when you go through it, you're pretty down after you go through a surgery to have your prostate removed because it's going to limit certain things. But in my case, I was afforded the option of what they call nerve sparing surgery, so that I continued to, have a sex life from that point on, and that's something I wanted to do. But when you go to talk to doctors, you get a lot of options of things to do, not only about what do you want to do in the future, on with you right now. In other words, if you need to go take a look at the type of cells that are in your prostate right now, and what that means for you in the future, is this a fast generating type cancer or not? You have the options to go get that checked. So it's really important to have a really in-depth discussion with your urologist or oncologist when you're going through that, because they can give you options to make better choices.
Yeah. So what I'm hearing from you is just asking the questions, being informed, not guessing. It's So, you know, it's basic, right, communication, but sometimes it's just getting the conversation going. And, you know, this day and age, you know, even getting a healthcare office to pick up their phone to answer our calls can be challenging. So we get it. And in part of the follow-up that you're going to get from the Harvard Football Player Study, you're going to get resources, because a lot of this information, you don't even, I mean, while we encourage people to ask healthcare providers, we can do a lot of online learning. You know, Bucky, what's been helpful for you? Some resources online.
I've got a, you know, I'm sitting here right now with the book. It's just a prostate cancer patient guide that is through PCF, prostatecancerfoundation.org. That guide has everything almost you would want to know about prostate cancer, what level you're at, what to check for. It even tells you what a prostate's there for and what it does. I don't even know that. So I'm just saying that's a great guide. You can go to their site, pcf.org, and all the guides and all the discussions they've had with doctors are there for your use, free of charge. They'll send you the book free of charge. All you have to do is contact them. So it's a great resource. It's one of the groups that I'm trying to get hooked up with the Pro Football Retired Players Association, so we can get the word out to all the, you know, all the alumni players, have that information in their hands. And that's part of what we're trying to do over the course of the next 5 or 6 months.
Awesome. Thank you, Bucky. So we're going to wrap up this session, and I'm going to go to each one of you to give your why this matters takeaway message to the crew. And so Dr. Baggish, we're going to start with you here.
Well, first, Amy, I want to thank you and everyone else on this panel tonight for being here to share what has been a journey and an ongoing journey for us in the Football Players Health Study. For me, the message is simple, and that is we all have a personal responsibility to be assertive in our own healthcare, and that requires educating ourselves about the things we're at risk for and being prepared to talk with the medical professionals that we choose to go to. I have a lot of compassion for primary care doctors. They have a very hard job to do. And the more prepared that we as patients can be walking in that door, whether it's using the checklist that we're going to be providing for everyone or just simply doing time on your own, educating yourself about what matters health-wise, that makes a big difference, and that will make your doctor's job easier and your partnership with your doctor more successful. Again, I just want to thank everyone for being a part of this and for all the support for the ongoing work we're doing.
Awesome. Thank you, Dr. Jenkins.
I just appreciate being on this panel. I think it's really important for men to get screened, especially for prostate cancer, and especially African-American men who have a higher risk of getting prostate cancer and a higher likelihood of dying from prostate cancer. So getting screened is the first step, just getting a simple PSA test, and just increasing awareness in this. I think that's the most important thing.
Awesome. Bucky.
Yes, I'd have to say that the big thing of what I'm trying to do with my health, even at my age, I'll be 70 in December, is that I'm trying to stay ahead of things, or what's the term they use, get upstream from things. And that's what everybody needs to do. You need to care enough about to go get educated about healthcare and what you can do for yourself. You can't sit on your butt and not do anything. You need to get up and go find out things.
Love that message. Rodney.
Yeah, I'm excited to be a part of this. Number one, because I think it's important for us to take the stigma and take the scare out of healthcare. It's been there for so long, and especially with men, as others have mentioned, that we don't want to go to the doctor. We don't want to get ahead of things because we simply don't want to know. And that's the wrong attitude to have. If I can help one person, or really help influence one person to just go get checked out, go get screened, then that is what my platform should be used for. And we do all have a tremendous platform to help others. And that's why this is so important.
I love that message. Mark?
Mentioned it a couple of times, right? That story about playing next to, especially an offensive line, you know, there's a brotherhood there that is the closest thing I can compare it to is the military. When you get together at those alumni events, when people ask us, you know, the rest of you guys are on here, when they ask you what you missed the most about the game day was fun, practice was fun, lifting weights, being in great shape was fun, earning a lot of money was fun, but end of the day, you miss your buddies, you miss the camaraderies, right? That's why you go to these alumni events. It's not to be on the sideline and watch the game, you know, this close. The view's not that great. Your knees hurt after 30, 40 minutes, you're like, oh man, this is terrible, right? What you miss are your buddies and that experience together, right? Enjoying your post-career life with your buddies and going to those alumni events and seeing those things. Some of you probably have a similar experience to me. A lot of the communication I get from my former teams is about people passing, and that breaks your heart, right? And there's things that are preventable these states, things that if they caught earlier, if they got on the ball and took care of themselves. And it ties into even some of the suicide prevention stuff and mental health things. It's like, advocate for one another, take care of each other. You were teammates once on the field, be teammates together for the rest of your life, right? And all of this stuff and all this information, the weights won't lift themselves. I always had a coach that said that, right? The gym is there for you to use to get yourself in great shape. Same thing post career. All this information, all the tests, all the resources are there. We have to go in and put in the work. You were once the best at what you did as a professional athlete. Be the best advocate you can for yourself and for your family so that you can enjoy your life after your career and enjoy it with your teammates for as long as possible.
Wow, I love that message. That is a very powerful message. What I love most about my job, and I'm sure Dr. Jenkins and Dr. Baggish can say the same, we can help a lot of people. We can help a lot of people because we have so many tools in our toolbox. And it may be something as simple as a PSA test, or I certainly see it with my low testosterone patients. You treat the appropriate person with testosterone. It is a game changer and a very safe therapy. We have tools, and a big part of that is just accessing the healthcare system and asking for help when you need it. Folks, I feel optimistic. I feel so optimistic. I am so grateful to be a part of this event. I'm so grateful that we've been able to collaborate with the Harvard, football study. And the fact that you all are here today and you stayed until the end means you are ahead of so many people. And we congratulate you for taking charge of your health.
And if you're not signed up to be a part of the study, sign up. It helps you stay informed of what's going on, and it helps generations to come. So that's the plug for signing up, fellas.